Today is the 1st of June 2021. I'm supposed to be at the hospital for my surgery to remove my uterus, but I cancel it. So I'm stay here. I want to talk about the problem, women and health problem. Since last year, I started this treatment. I have fibroids, and later I found out I have endometriosis as well in my reproductive organ. So the first thing, I've been suffering from this for a long time, since I ever known as a woman, since I started to have menstruation. So I have been dealing with pains, severe pain, severe bleeding all the time. Every month I was in hell and back. So, but recently it's getting worse and worse. I want to deal with the problem which are also connected to other part of the organs of my body. I could not run properly anymore. I could not do exercise. I could not function regularly anymore. I could not function normally anymore. So I thought I have to get the treatment. So I went to see the doctor, gynecologist of my maybe 15 years. She been as my gynecologist. And the first thing she found out was I have fibroids. And she asked me, do you want to remove your fibroid, 3 of them, and 3 centimeter long and quite large? Do you want to remove your uterus? I said, what? I came here to see you to feel better, not to feel miserable. Do you ask me to remove my uterus? Uterus is part of my female. Being a female and part of my identity, part of a woman. It's no way that I want to remove my uterus. Can you please give me other options that to treat the problem? And she gave me this medication. So this medication I took for around 5 months, I think. It didn't get better. I get worse. My problem get worse. The bleeding continue the whole time. It never stopped. The pain was not going away. And the problem didn't solve, in short. It get worse. Never before. But additional burden, what I got was gaining weight. And I could not eat normal food that I used to eat, the amount that I used to eat. It given me just whatever, even if I consume air and I get fat. So it's the side effect of this medication was very bad. So I could not bear with that, and I asked another doctor, my internist, do you know any doctor that could help me? And a gynecologist, a good one. And my internist recommended another gynecologist, which is his colleague, and then so I went to see another one. And another professor, university, medical doctor, whatever, gynecologist, and with long title. And he gave me the injection again, but he was very kind enough to give me different options, to discuss with me different options. And the first thing you could try was an injection, which injection was a depot. And he gave me that injection for 3 months. It has to be for 3 months. After 3 months, you have to get another injection, this one. And so I got the first injection. That injection I didn't know was I'm going to suffer weight gain again. And after that injection, it didn't get better. And I'm even faster gaining weight. And the problem of the severe bleeding, severe pain, severe or continuous daily, continuous bleeding didn't go away at all. So finally I make another appointment with my former gynecologist to explain. I got the second opinion, and then there are the options that I could do. But the problem I don't want to deal with, I just want to remove the fibroids because I can't have this hormone therapy anymore. This hormone therapy makes me miserable. I'm just gaining weight and I can't handle this problem, and I have to deal with this weight gain again. And that's not possible. So, okay, she said she's not doing surgery anymore. She only deliver babies and then so on. So I should go to see another surgeon that he will decide what to do with you. She didn't say that I have to remove my uterus, but most likely that I have to remove it. So that's the only option she could think of, but she didn't say that. But she asked me to go to see my colleague, and he is the best surgeon you can have, and he will decide what to do with your problem. There I went again to see the surgeon that discuss with him about my problem. He checked again, so he told me that it's not only the fibroid problem. I have the endometriosis, which is in the lining of my uterus. You see the endometriosis? There they are. Yeah. So endometriosis was the problem. Fibroid was you can live with that. It doesn't give you a huge problem, but endometriosis is the main trouble you are going through. Because of that, you have heavy bleeding, heavy pain, and all kinds of problem pushing to your bladder, and you frequently have to feel like urinating, and that's all these problems caused by endometriosis. So that's the end of it, and he said I better remove my uterus, and he's going to cut the uterus and he will leave the ovary, so I can never have babies again. I cannot get pregnant, but I will still have menstruation. I won't go for menopause. So that's the issue that I have to deal with. And then he told me that think about it and then just send me a message. We can do the operation, we can do the surgery on the 1st of June. So we make arrangement for the 1st of June to have the surgery. And a week before from today, the 1st of June, I discuss about, but by coincidence, I discuss about this with my friend doctor. She is a GP, but her sister is the gynecologist and the professor as well in Myanmar. And then I sent all my medical report to discuss about this, and she said there are options that you can do, which is the problem will not solve removing uterus, and then it won't stop. It won't stop. It will continue because the issue is the estrogen, which is produced by ovary. As long as you don't remove your ovary, and the ovary and uterus, they work together. And if you don't have the uterus, and the ovary still will produce estrogen, and the estrogen will go, the endometriosis will go to other part of your body. So the issue will not be dealt with this removing uterus. So I was very nervous. Then I already feel like I never wanted to remove my uterus first and foremost. And then now I know that will not solve the problem despite losing my uterus. So I wrote to the doctor immediately that I want to postpone I want to cancel this upcoming surgery. I just want to get another treatment and not by surgery. So, and he didn't make any trouble. He was kind enough that it's okay. So I canceled that. And then there are options that my friend told me to deal with this estrogen level, to control the estrogen level, which is making this endometriosis alive and growing and being happy in my body and trouble, giving me so much trouble. So this, to control this estrogen level, she suggested GnRH analogs, and the second one is ablation. So either I use, or a combination of both, the ablation treatment or the hormonal therapy. Again, this is to control the estrogen level and to stop the estrogen. Then I will have to deal with this not having estrogen again. So hormonal therapy, I don't want to do hormonal therapy, but it will this endometriosis, the cyst will reduce the size. It has to go the fibroid and the endometriosis, all the cysts, so all these tumors will have to shrink. If they don't get the estrogen, they will have to shrink, and they will have to getting smaller, and they will have to, maybe they won't die, but they won't grow anymore. So by controlling estrogen, only by reducing level of estrogen, and I can deal with this these tumors. So, and I suggested my OG that I would like to try these two options. Ablation will not be any risk-free either. It will damage, because ablation is also using the heat and the extreme cold to deal with this tumor, and it can also damage the organs as well. But at least I don't have to remove my uterus or ovary or the whole organs, because if I remove the organ, it will have the other side effect, which I will have to deal with, and the result will be the early death. And I cannot control my urination. The whole system will collapse, because it's lack of the space, and the body, they have to support each other. If there is no support, and the other organs will not be maintained in its own place. So there are many other issues that I will have to deal with. So I think this canceling of surgery to remove my uterus, I think it was a good decision, and I have to see what next, and then I have to try other options to deal with this endometriosis and all these tumors in my reproductive organ. So don't rush because hysterectomy is is the industry in this female health. And don't rush to decide to remove any part of your female organ because the doctor says so. That's my message to you. And you have to try, you have to do your own research. You have to take your health in your own hand. Don't trust anybody. Do your own research and decide what is best for you, and try every possible options available for you. Okay, I will discuss further as my treatment goes. Now, at this moment, just want to tell you that don't rush, and I'm not rushing either. I will try different options, see how it goes. Okay.